I bet. I apologize for that annoying
That's okay.
recording message. Let's see here.
Megan,
Sorry.
you're in Houston, right?
I am. So same place Aisha is actually, and Cheryl. Hi,
Okay.
Cheryl. Good morning.
Are y'all getting rain today?
So just as I was walking in the door, it just poured. So I'm wearing a like satin pants.
Perfect.
Just
That's awesome.
But it's
Yeah.
very Houston for it to just all of a sudden start pouring down like that.
Yeah. It poured here all last night. We got 4 inches last night of rain. And when I got out of the happy hour, I walked out and you can see straight out our front door. And I saw my littlest one just dancing around in the rain in her school clothes with her big pink bow on her head. And I was like, that's what happens when you leave dad in charge. Perfect.
You know what? Good for her for enjoying it, you know?
Yeah. Yeah, for
I mean,
sure.
you also probably have to clean up afterwards. So
All right. But that's
It
okay.
happens.
She had a blast. The
Good.
bow, I'm afraid is
No
gone.
more.
But yeah, it was fun while it lasted.
Where are you at?
We're in San Antonio.
Apparently it poured in San Antonio last night, Cheryl.
I saw through the hill country, it looked like they really got rain.
Yes, we like those wild, violent storms. It's very sporadic, but they come fast and hard, and then they're gone.
I think there's a couple people from Minnesota on the call last night, but it is very different. I have never, like when it rains all day, but like normal. I feel like in Texas, what happens is some like the air picks up a chunk of the ocean and just drops it, like just a whole body of water. It's not individual raindrops.
So true. My husband's from Ohio, so he seconds that. He's like, I don't understand what y'all are doing around here.
Crazy.
Hey, will you bring Gail in?
Yes. All right, Gail, I should have just sent you a request there to be a panelist.
This group is anxious. Everybody's signing on time. Good for you guys.
All right.
Good morning, everybody.
Good morning.
Good morning.
All of you, this is Gail, Dr. Gail Bryce. She is your moderator for this morning.
Nice to meet all of you.
Morning.
Nice to see you.
I apologize, everybody. I've always got to take the first few minutes here to find any emergent emails and make sure I've got all the different things open here. So give me just a few more seconds and I promise I'll be more personable.
No, you're fine. You just keep your eyes on what you need. You're the whole kingpin for this thing.
So are most people on via Zoom or Hoover?
So most people should, even if they went through Whova, should click join via Zoom to avoid any delays in slide sharing and things like that. Sometimes that communication chain can get a little choppy if it's not. So I hope everybody on the call, actually, that's a good call out. Everybody, if you went through Whova initially and got the option to go through Whova or via Zoom, you chose via Zoom, or you had a direct link for me earlier in the week. If not, then if you could actually exit and then rejoin the call, that would be best, just to avoid any of those little delays. Thank you, Gail.
I said that only because it took me a couple of times. I was trying to go through Hoover and it really didn't want me to go on through Hoover. So
Yes.
You get on through Hoover, you usually end up as an attendee.
oh, okay. Well, that's how I was doing it, watching yesterday and Tuesday. So Okay, got it.
Attendees don't get to speak.
It's remarkably smooth from my end, watching, all the orchestration.
I love to hear that.
Yes,
I'm
no, I mean
very
it.
happy.
It's like,
A fantastic job, and I'll tell you, the last 2 days have just been wonderful. We've had great presentations.
I know.
And don't worry, there's always some little something that happens in each one of these sessions. We laugh. We always have to have one, so don't panic because Megan can handle anything. So.
Yep. I'm learning. So I've decided this is going to be my new line on my resume is just figures it out.
Problem solver. That's a good one.
That's
Problem
right.
solver. I don't know how. We'll just figure it out. Keep clicking buttons until something works.
It's a skill that I think all women have.
I
Definitely.
agree. I think it's probably one of the most impressive skills, most valuable.
Also to have a sense of humor when you're trying to figure it out.
You know who was a champ? I don't know if you guys were on the session when, and forgive me, I can't remember her name, but she's the CEO of Gabby. She
yeah.
had
was good.
just, her presentation was phenomenal, but she just, if it could go wrong, it did go wrong. The slides didn't work and the tech was glitching and her sound was glitching. And then she obviously had to move in somewhere there was somebody else talking in the room you could hear. And I felt so bad because her presentation was so good. And I wanted so bad to jump through her screen and tell that man to shut up.
So I was emailing her back and forth trying to figure out. So she was at the airport, went through the trouble of getting a private room with her own private all of these things. And then the Wi-Fi dedicated to that room went out. So she was in the middle of an airport lobby, managed to collect herself and still, which I think is impressive.
She was great.
That's very impressive.
I would have definitely been like, I tap out.
Well, my mouse has just died, so I'm gonna have to go on video for a second, go find a cord.
We have all of our presenters already on this morning, so that's wonderful. We have some of our judges. Don's joined us, and Bill and Jeff. Thank you for being here.
Bill, your background is very impressive.
I appreciate that. Oops.
It looks like something out of a magazine. All the organization and all the books and everything. Very aesthetically pleasing. I think you're on mute.
No, every now and then you find a backdrop or a screensaver. I've got a ceiling fan and stuff, and that just ends up being really distractive if I don't have an artificial backdrop.
I have art on my wall at home that looks really weird, like it's not placed right, but with my camera, it's placed perfectly. So it's placed exactly where it is just for video calls. But if you're just in a space moving around, it just feels a little lopsided and kind of in a weird spot. It's funny how we all adapted to that kind of thing.
And with these artificial backdrops, you get some really strange digital artifacts. If all of a sudden you move or you move quickly or you tilt your head back, you look like the Headless Horseman or something.
When I first got this backdrop, I wore a white shirt the first day. It was a horrible mistake. I just was this floating head and I thought, oh my gosh, that's horrible.
Okay, you guys, real quick. I think first thing for everybody that's on the call right now, it can be a little bit easier probably for Dr. Braswell to go through the panelists because there are quite a few of you and we've got everybody in that needs to talk, or at least at some point, to put either judge and then your name. Jeff, you're on the ball, you already got that done, or your company name and then your name, so that when we're looking at that list, we can see who is a judge versus who is pitching. They make it a little bit easier to manage that list.
How do we do that? Can I do that right now on the fly?
Mm-hmm. Yes. So
Rename.
you got it.
Okay.
Perfect.
Where is it?
So if you right click,
Yeah, my mouse is plugged in. I'm
oh yeah,
sorry.
that's right. So if you do the one thing that you can't do right now,
Unplug.
We know you're the moderator, though.
I was gonna, and mostly it's for you to be able to tell when hands go up or when people are speaking, who is who. So if you don't, that's probably the best person to not do it.
Okay.
No worries there.
Sure.
Just to give you a little rundown on what we're gonna do today. We'll start with a video, then Aisha will come on and speak for a little bit. She'll introduce Gail. Gail, you don't have to go through that whole little speech we sent you, just, whatever you want to say and, good morning and all that, then get started by introducing the first speaker. You get 7 minutes. Gail will be watching the time, and so will Megan and I, and we'll cut off at 7 minutes. The judges get 8 minutes for questions. They can raise their hands, and that helps Gail to know who wants to speak, and she recognize you, ask your question. After the third person, we have 6 people today, so we have a bigger session today. After the third person, we'll have a little bit longer break. In between each speaker, we'll have a 1-minute break with just a slide. We took away the music because the judges found it distracting. So that's judges' time to finish your scoring. Everybody got their scoring tool. Let us know if you don't. And then after the third person, we'll have a little bit longer break. We'll talk a little bit about the PNC, and then we'll finish the group, and then Aisha will come back for closing remarks.
Cheryl, your sound quality is a little compromised.
Yeah, I know. It's my microphone and my computer, and I'm not going to say anything more throughout this thing, so.
All right.
Once the session starts, Cheryl mutes herself. Her computer's microphone has decided it's done working. It's retiring, going out of business.
Could someone resend the scoring tool? I don't.
Absolutely.
Thank you, Megan.
Of course, my pleasure.
And if you're not speaking once we get started, if you will just turn your video off so that we just see the presenter during their presentation. And Megan will give us a 5-minute warning as we get ready to get started, and that's when everybody can kind of turn their cameras off and get set. But until then, we can go ahead and keep talking, except me, because I can't talk.
We had a quick question, so I'll clarify a little bit. So because Zoom tries to be helpful by switching the screen over to people who have video on or people that have audio on and are making some noise. Sometimes, especially when people are trying to pitch, that can get a little bit, it's actually being unhelpful. So for all their good intentions. So best thing is while somebody's pitching, for everybody to turn video and audio off, just so that Zoom doesn't try to be helpful. But once the Q&A starts, so that it feels conversational, it's great if the judges can get back on camera so that we can see everybody's faces while we have that conversation. So I hope that helped there, but if I can clarify any other point, happy to do so. And then just so everybody remembers, for the audience members or anybody that is in Whova right now, your profile as a speaker will be beneath the screen that they're watching in. So they can go find some information on you, all of that stuff that you uploaded directly beneath that screen. So we'll make a call out and say like, hey, I usually put in the chat, Cheryl, Aisha usually say something about please connect afterwards if you have more questions or are interested in hearing more about what they're doing. But just so you're aware while you're going through this, kind of what those audience members are seeing, it'll be that screen. Your speaker profiles will be available beneath that. And then for people who uploaded and attached documents, I know you have one that's beneath there and you can actually see it in the session. So that's there as well. So if it feels comfortable in your pitch, please don't try to ruin your flow if you're trying to add things last minute, but so you're aware you can direct them to that spot as well.
Megan, will you bring in Michelle Stansberry?
Of course.
Megan, I was only able to upload a document under the section called resume. So I don't know if that's the right spot, but I labeled the document executive summary. So I figured anyone who's interested could download it from there.
Absolutely. If you want me to make it a little bit easier to find for folks, feel free to push it to me and I'll make sure that it's showing up in a few places in the platform just to make it really easy for people to find it. So please feel free to send it my way.
Okay, thanks.
Absolutely. My pleasure.
And judges, one last important thing, please, before you leave today after the session, do your scoring and click submit.
Michelle, good to see you. It's weird to see you on this,
You too, Megan. I feel like it's been way too long.
It has been.
I know we need to get together outside of this. So where is the scoring sheet?
I'll send it to you right now.
Perfect. Thank you.
My pleasure. All right, you should have that link in your chat.
Got it.
Perfect. And then if anybody, so one of the things we have learned over some of these sessions is, you know, if you're in a place that you weren't expecting today, if you want to quickly test your video, audio, whatever, this would be the time to do it. To Summer's point, we had to be creative a couple of sessions. We worked around it, made it happen, but happy to test that out now.
Hello, testing my audio.
Stephanie, you sound good.
Thank you.
Well, I'm up first. How do I sound?
You sound great. Do you want to try to go through a couple of slides as well? Or do you, I feel like I remember your excellent background, so I know that you're in the same place.
Yes. Hopefully after over a year and a half, I've gotten this down.
I think that all of the time, and then I managed to not have it down. So
Can you see my slides?
it looks good. You're in
How about now? Hold on. How about now?
perfect.
Okay. All right. Awesome.
And Lydia, I just got your email, so I'll go ahead and make sure that's connected all in the background to make sure it's showing up everywhere it can.
Thank you.
My
Megan,
pleasure.
would you mind if I pulled up my slides? I just want to know if I can toggle with the arrow or if I have to use my mouse.
Of course, please do.
Thank you. Okay.
It's moving well. Yeah. All right, and any of the judges, if you need the scoring tool, I was trying to go through and grab you all, but just to be sure, if you need the link to the SurveyMonkey to submit your feedback, please let me know and I'll send it over. So just send me a quick chat or even just tell me live here. I'll make sure I get it to you.
Megan, I just want to make sure that you can hear me properly.
You sound very good, very clear. You want to try any slides?
Yeah.
That's okay.
Yeah, just see
Go ahead.
whether okay.
Perfect. Moving well. Doesn't seem like there's any delay.
Megan, can I try as well?
Absolutely, please do.
You see just one screen that says resolve.
Okay, now it's moving.
Okay.
The only thing we can see is that top bar, but I think that's fine. It looks like you're using the PDF version, which is totally fine. Just wanted to let you know we could see that at the top.
Okay, yeah, that's fine.
Oh, Elizabeth, moving you over right now. Sorry.
And what's worked best with the judges when they raise their hand, or, what's the best way for me to cue them up?
So actually, it's up to you. So we will have people who raise their hand in that panelist, especially if there's multiple questions, they'll try to just raise their hand in that attendee panel. I mean, people have also just been speaking up, which is great as well. But if you have a preference, really whatever works for you best is what we'll do.
Megan,
Yes, ma'am.
Aisha's having trouble getting in.
I will figure it out.
Please, because I can't be Aisha.
So Megan, could I share, and you can hear me as well, hopefully?
Sound is good.
Good, and I share my screen, try to look, see if it works. Yeah.
Looks good.
Yeah.
Perfect.
All right, thank you.
Hey, Cheryl, I just sent Aisha a new direct invite to Zoom. And then, Gail, is there any names of companies or people that we should review right now? Because I know.
The ones that I wasn't sure about, I Googled, so maybe it'd be better.
Very smart.
No, but I mean, it'd be better if I could hear their names, and then I could possibly get them all right. So
Yeah,
if we start, could we do that real quick?
Yes, absolutely.
All right, so we could start with Anne. Anne, can you say your name?
Anne Garnier.
Anne Garnier. Okay, great. And then Yael? Yael?
Sorry, I'm on mute. Yeah, I'm on mute. It's Yael Hanen, but it's perfectly fine if.
Yael Hanen.
Yes.
How's that?
Pretty
Yael
good.
Hanen. On a scale of 1 to 10, is it like a 5?
At least a 7.
Okay, good. All right, I'll take a 7. Lydia Henshaw.
That's it with Resolve.
Resolve. Okay, great. And then Dor Vonk.
Yes, absolutely.
Okay, wonderful. And then Summer Babarick. Where's the pronunciation on that? Babarick?
Summer.
Summer.
I think.
Okay.
We had her on a second ago, but I can't find her now. So let me figure out what happened there.
Rachel Bartholomew.
Yeah, you got it.
And it's Hi Ivy.
Hi, Ivy. Yep.
Hi Ivy. Okay, Wonderbar. Okay, thank you. Thanks, y'all. And hello to all the judges out there. I don't have to introduce you, so that's good.
All right, so for anybody that has joined us in the last few minutes, especially as we get closer to 9:30 here, we will start with a quick video. Aisha will make some opening comments, and then we will move into pitches. And Aisha will call in you, Gail, to kind of give another welcome, introduce some folks, and then just move right into that first pitch. Every pitch will be 7 minutes. Gail's going to be firm, and it's because she has to be. And then we'll move on to 8 minutes of Q&A. And at that point, in between each pitch, we will take a 1-minute break. with the exception of after the third pitch, which will be a slightly longer break. We'll watch a little video and things like that as well there. When we're all finished, we'll again say some thank yous. Aisha will make some closing statements. Judges will finish getting all of their information in, and we should be set. While we're going through the different pitches, just to remind everybody, if you're not pitching, to have video and audio off, just so Zoom doesn't try to flip between folks. And then judges, please feel free to turn your cameras on and things like that for the Q&A, so we can all have that group discussion. Any questions about that? Because I ran through it really quickly. Happy to help any way I can.
I saw Aisha coming on. Oh, there she is.
I see her in the panelists. Aisha, are you? I can see you, I just can't hear you.
Good morning, I'm here. I've had an issue with my computer. And so I've had to get on another computer, which then means my presentation is hold on, let me send my presentation to myself. 1 second. Let me work through this. Sorry, I don't know what's happened to it.
No worries.
Give me 2 seconds.
Of course. And then it looks like Summer, I got you back on here.
Grant, how do I? There we go. Okay. So you all hear me, right?
Yes.
You sound good. Look great as usual.
I don't know what's happened to my
Look forward to next year when everybody can be doing this in person.
Me too.
Hey, in January, you can come to the in-person, finals, which would be awesome.
And Bill, you know where we're at.
Yep.
Okay, I'm going to. Right, Grant McCracken. Hold on, I have my IT guy here. That would be my husband.
Great. And for everybody else on the call, we are just a couple minutes away. So if you want to go ahead, this would be a good time to turn video off and click that mute button. We'll do some quick problem solving with Aisha here, but then we should be all set. And please feel free to send me a quick chat message or email me, whatever works if anything comes up for any of you. Happy to help.
All right, give me 2 seconds more. This is. God, not being my friend today. Megan, I'm going to send this to you. Can I do that?
I'm sitting here talking unmuted. Yes, ma'am, of course.
Okay, it's coming your way. Will you just start it for me?
Mm-hmm.
And I'll cue you as to when to change. Okay, tell me if you got it.
TMC or Ignite?
Oh, TMC it should be. This one, every session has had a thing. Do you see it?
You want to go ahead and send it to the Ignite one real fast? Might be quicker.
Okay. That is just.
And attendees joining the call, we'll get started real quickly here, just a couple of minutes.
All right. Okay, Megan, I've sent it to both and it's coming from my Innovate account. Got it? Great. All right, I'm going dark.
We want our voices heard at the podium, in the boardroom, and at the investors table. We want our voices to be proficient, inspiring, and confident. We want our voices leading innovation, patient care, and opening doors for others.
The Ignite Healthcare Network is a nonprofit organization dedicated to enhancing the influence, proficiency, and entrepreneurial talent of women leaders in healthcare.
Women are, as we all know, vastly underrepresented in the founder community among startups, also in the investment community, and also in the healthcare community. So every part of the chain, there is a challenge.
Ignite is attracting women healthcare executives or women in healthcare that are from such a diverse background that by connecting us all together, it in of itself creates innovation.
Really creating innovative solutions, not just in technology, but in sciences and other programs.
Formed in 2017, Ignite's programs, networking and mentoring events, and accelerator competitions promote the advancement of women leaders transforming healthcare.
Sort of Ignite to me is creating this diverse portfolio of women and possibilities.
It's almost daunting, the talent and the accomplishments, the skills that are in that room. But once you start talking, that's not what you hear. It's the support, it's the camaraderie.
Ignite allows me the opportunity to stretch. It allows me the opportunity to get exposed to areas where my own area of expertise, may not be enough. I am learning.
The knowledge members gain and connections they make ignite ambitions, fuel leadership, and spark answers to critical decisions shaping the industry.
You can expect to be surrounded by enormously accomplished women who are there to support you and to collaborate with you.
To really make a difference in healthcare, technology, or STEM programs.
There's no limit to what bringing diverse talent together can create.
For us, the sky's the limit.
Hello, everyone, and welcome to Ignite's 5th annual pitch competition, focusing on women-led digital health and medical device startups. We have had 2 incredible days of pitches so far, have heard from 21 entrepreneurs, have been inspired by some great innovation that they are bringing to life. And today we have 2 pitch sessions. Today or this morning, you're going to hear from 6 startups everywhere from the US to, I believe, Israel is the farthest destination that we have on the pitch deck today. We are thrilled to continue to attract these incredible entrepreneurs. The 5th year of this event, and we had 263 women in our application process. 130 actually completed and came over the line. We now have a database of over 600 women-led companies from around the world, and we're excited to see the kind of work that these innovators are doing. Today, you're going to hear from 11, and in the process, Megan, you don't have my slides. There we go. Can you go to the next slide? Thank you. So our process, as I said, 130 companies came through our application process completed, and we had over 120 hours of volunteer time spent by VCs, physicians, industry experts who selected these 32 companies who've been pitching for the last 2 days now, finishing today, as the best of the companies that had come through our program. You're going to hear some incredible pitches that are going to impress and inspire you. As I said, the last 2 days have really been incredible. Megan, if you could go to the next slide, please. We can't do any of this work without the Mini Accelerator program and the time that our partners, investors, and customer partners dedicate to supporting and mentoring the companies that have been selected for this year's cohort. What really distinguishes this program from everything else is the intense opportunity for them to connect and interact with organizations that represent the voice of their customers and organizations that represent the voice of their investors. It's with these mentoring interactions that they get to evolve and prepare their decks, but also gain meaningful, valuable connections and insights for the continued progress and development of their companies. So we are grateful for all the time spent by these incredible organizations in preparing our startups for pitches, but also in the valuable information that they exchange in working with these startups. Megan, the next slide, please. Ignite is fueled by sponsors and sponsors who have supported us for many, many years. We want to thank this incredible group of sponsors and really appreciate not just a one-year sponsorship, but the partnership that we have with each of these firms. We appreciate the continued support. Many thanks to our sponsors. Megan, next slide, please. So we'll get started with the competition and want you to understand kind of how this works. This is the semifinal round. The judges' votes will be influencing and selecting those companies that move forward to the live final pitch competition that'll happen January 20th at the Texas Medical Center. And so 6 companies will move forward from the panels, pitch panels, and then the audience gets to participate. And the audience also means the judges. So each of the pitch sessions will be posted at the end of, or videos from these pitch sessions will be posted at the end of each day. So if you're interested, take a look. You'll be amazed at the work being done by these entrepreneurs. And if you have a favorite, then please log on to the SurveyMonkey link. It'll be provided to you in the chat as well, and cast your vote. Voting is going to end 11:59 tomorrow, so that we are prepared to make an announcement for all of the winners from these events, these last 3 days, and announcing who will move forward to the final competition on Monday morning. So Monday, the 18th, the announcement will go out, identifying the finalists for the pitch event. And Megan, next slide, please. So the grand finale, save the date, please. We are going to do this live at the Texas Medical Center at the Innovation Facility which is a fabulous place. And we're going to have a VIP reception January 19th, the evening before, to bring everyone together. So these have been incredible opportunities for this ecosystem to interact with one another. It's been remarkable to see the Whova platform that we've used has gotten great reviews. We've had over almost 300 people engage on Whova for these last 3 days. We hope that some of you, if not all of you, will come and join us at the TMC. And if you can't join us, we're going to find a way to broadcast and bring this to you virtually as well. So with that, it is my pleasure to introduce Gail Bray, who is going to be your moderator for this morning's session. Gail has a PhD in public health, is a philanthropy and public health executive, invested in multidisciplinary initiatives, social equity, and social justice for communities, specifically with marginalized populations. I'm happy to say Gail is one of the founding members of Ignite. So with that, I'm going to turn it over to Gail to get the session started.
Thank you, Aisha. And thank you for that wonderful introduction. Hello, everybody. Good morning. And this is our final day of the Most Awesome Pitch. This is our 5th year. And this, of course, is our last day of our 2021 semifinals. And today, of course, you will be hearing from women-led healthcare companies as they pitch to a panel of our industry expert judges. And as Aisha mentioned, today's event would not be possible without our great sponsors. Special thanks to Johnson & Johnson and the Texas Medical Center Innovation for their many years of support. So everybody knows the format, 7 minutes per speaker and 8 minutes for the judges. So, all right, everybody, sit back, relax, and let's get started. Our very first pitch this morning is by Anne Garnier with Lisa Health. And Lisa, I'm going to turn it over to you, and your 7 minutes begins now. Good luck.
Thank you, Gail. Hi, I'm Anne Garnier, the founder and CEO of Lisa Health. Lisa Health is the first digital health platform for menopause and healthy aging. You know, researchers are starting to recognize that chronic disease may originate or at a minimum be exacerbated by the rapid decline in estrogen and top menopause symptoms like hot flashes and sleep disturbance. And women of color and women who already have a chronic condition are incredibly vulnerable. So menopause is really this wedge in when women are highly activated to solve for bothersome symptoms. And it is our golden opportunity to really change the trajectory of health and longevity for women in midlife. Like most women, I had that typical disappointing doctor visit and lack of support despite being a very knowledgeable and empowered healthcare consumer. You know, it's not surprising when you consider that fewer than 20% of physicians are trained in menopausal care, and even experts lack time and tools. Only OBGYNs get about 1 hour of training and protocols don't exist. So this is a market where women have expressed a clear preference for non-invasive technology to manage their menopause journey. So Lisa Health is solving this entire problem with a data and AI-driven platform approach that integrates the ecosystem for women. Our precision medicine platform uses advanced technology to efficiently and effectively scale primary care and bridge that gap for women. So we deliver with our mobile app unprecedented insights, tools, and evidence-based therapeutics to let women quickly take control of their menopause journey and thrive in midlife. And our app features patent-pending technology specifically around hot flashes, sleep, and menopause staging, along with advanced symptom tracking and delivery of menopause-specific therapeutics, ranging from biobehavioral programs like immersive meditation and cognitive behavioral therapy to telehealth services. While our solution provides comprehensive management for menopause and healthy aging, our initial IP, developed with SRI International and supported by the NSF, focuses on the top 3 menopause biomarkers: hot flashes, sleep disturbance, and menstrual cycle irregularity. We are the first company to be able to detect and predict hot flashes in real time at 95% accuracy. This is a game changer for the most bothersome and unpredictable menopause symptom that 80% of women will experience for 5 to 7 years on average. And we now know that sleep disturbance is extremely detrimental to midlife women's health. Unlike mainstream sleep technology, our patent pending algorithm gives women insights into their unique sleep patterns and delivers menopause specific therapeutics specifically designed to help them fall asleep and stay asleep. And our menopause staging algorithm gives women the insight and predictability they desperately seek to understand where they're at in the journey and prepare them for that menopause transition. So what's different about Lisa Health is that we are pioneering a whole new understanding of midlife biomarkers for menopause and eventually female aging. This is real science based on 10 years of data collected in a gold standard lab environment by world-renowned researchers like my co-founder Max, and enhanced through our NSF grant and a relationship with the Mayo Clinic. And that's why the Mayo Clinic, the #1 hospital in the world, the best of the best, came to us and invested in Lisa Health. They share our vision of building an advanced platform for menopause and healthy aging. Mayo experts are providing us with expertise and data to help us refine and create new algorithms, clinical pathways, and pilot our solution with their patients. So the current landscape, it's highly fragmented and dominated by companies offering single symptom solutions that are not personalized. And over again, we've heard from women that they want a convenient, trusted, one-stop shop solution. We actually have few competitors in this space. We really can partner and enable most companies by plugging them into our therapeutic platform. So we continue to build on our lead and advantages with a highly differentiated deep tech approach, IP, and a mission to build the largest data set on menopause and midlife women's health. And our team is uniquely qualified to win in this space. And we count the top research institutions like SRI, NSF, and healthcare systems like Mayo Clinic as backers. Our team and advisory board is the top team working in this space. Collectively, we've started and scaled several of healthcare's most successful companies and have led major research initiatives and discoveries on menopause and midlife women's health. No one questions the massive size and opportunity of this market. Women's needs are vast, and the market replenishes every day as more women begin this menopause transition. So we launched a beta. It was direct to consumer, and we tested our beta with 3,000 women. Our primary focus in 2021 and 22 is our joint development and pilot with the Mayo Clinic for validation and product market fit. And beyond this high-profile initiative, we're evaluating employer and provider strategies. Both give us access to large numbers of women so that we can scale and aggregate data faster, making the platform smarter and smarter with feedback loops. So ultimately, with a long longitudinal data set on midlife women, we can work with pharma around data analytics and clinical trial support. So our goal is to reach profitability within 3 years. There are multiple opportunities for exit and several categories of potential acquirers as more companies seek to integrate digital health solutions into their portfolio and expand their women's health continuum. We're raising $2 million for product development, key hires, pilot support, marketing, and R&D, and that'll get us to 12 to 18 months of runway. We hope you'll join us on this journey and help change the lives of 3.8 billion women. Thank you so much.
Thank you, Anne. And we will now turn the floor over to our judges for an 8-minute Q&A. Judges, begin. Please raise your hand.
Ask me anything about menopause. I'd love to answer questions about menopause.
Megan, I'm not seeing our judges for some reason.
Well, this is Elizabeth. I have a question for you.
Sure.
Could you go back to the competitive landscape and just do a little bit more detail on that?
Absolutely. So generally the way that this market breaks down is, menopause, it's a journey that lasts 30 years. There's 34 symptoms. So women have multiple needs on that journey. Most of the companies tend to focus on a single symptom. You typically see that with medical device, pharmaceutical options, and most of those products, as well as in other segments, are really user self-directed. They're not personalized, so the user has to, sort of determine what's right for her and how to use and when to use that particular product. There's quite a few companies that have come into the telehealth space, like Electra and Genev, Evernow. Their business model, primarily revolves around telehealth consultation and prescribing things like hormone therapy and offering supplements. We feel that those are opportunities to partner with those companies. We're including telehealth as a service on our platform, but there's a great opportunity to plug these companies into our therapeutic engine. So as we seek to solve the needs that women have across this journey, we can't possibly create all of those solutions, but we can partner and plug those solutions in and recommend them to women.
And the sensors is it a wrist device, or what are you using to get your inputs?
Sure. So it is a wrist-based device. It's a consumer wearable. I don't know if you can see it here on the little chat or on the little window. So we're not a hardware company. We are a AI data software company, essentially. So we're partnering with a hardware company that offers an FDA-approved medical grade device. And it's, from a sensor capability, extremely high quality because it is used in medical settings, and it's on par with Apple Watch and Fitbit in terms of the different signals that it could pick up.
Thank you. Does anybody else have questions? I'm still having trouble seeing.
Yeah, Gail, this is Catherine.
Oh, hi, Catherine. Go ahead.
Hi, Ann. Good to see you.
Hi. Yes.
Ann, would you elaborate a little bit more on what kind of data and what applications you're going to be deriving from this Mayo Clinic pilot study you're doing?
Sure. So our product manages menopause comprehensively, so all of the symptoms of menopause. So essentially, we are offering the mobile app to patients of the Mayo Clinic. They're using the app, onboarding, providing us with data, and then we provide them with insights into where they're at in their menopause transition, as well as really helping them to understand their unique symptomatology, because a lot of women don't understand how all the symptoms relate together. So we sort of unveil that aspect of things for them. And then our AI evaluates the inputs that are coming from the wearable sensors, as well as their mobile phone and their self-assessment on certain symptoms, and then delivers therapeutics that are specific to them and specific to menopause. So there's a broad range, as I said, and women need a lot of different therapeutics. So we offer ranging from cognitive behavioral therapy, immersive meditation, and coaching, as well as education, to connected devices, telehealth, and prescription-based services. So essentially, measuring improvements in symptomatology, of course, as well as women feeling better supported during their menopause journey. Those are two key aspects of measurements that we're looking at.
Thank you, Catherine. And now we'll hear from Michelle and then Stephanie. Michelle, go ahead, please.
Sure. Great presentation. I'm kind of right there with you on this side, but the big question is, you're offering suggestions, I'm assuming overall to the patient, kind of where they're at in their process. Mm-hmm. But how has Mayo worked with you on how you're getting this information back into sort of the clinical setting with the physician that they may be working with that can kind of work together hand in hand?
Sure. So, we're planning to take a phased approach. They very much want to support clinical decision-making and, physician access to that data, but integrating with, electronic medical records and other systems can be quite a heavy lift. So during the pilot, the patient can make the data available through, essentially a PDF report. And then we'll evaluate after the pilot, what are the right steps to take for integrating this into clinical practice.
And if I could ask one last question, I
Sure.
know we're on a time limit, but what feedback have you gotten from your participants who've been using the app?
Sure. So we've gotten, really great feedback from women who've been using our beta platform. What they like, number one, is it's, they feel it's a very trusted platform because it's evidence-based, but it's also a one-stop shop, for all of their needs. We've essentially done all of the legwork and curated this very high-quality experience for them. They feel very confused by having to try to figure things out on their own and having to go to different places online, whether it's Dr. Google or Facebook. It's very complex. They don't have a lot of time, and they don't have, obviously the training to be able to evaluate all of these different, strategies. So they just really like that it's all in a one convenient, one-stop shop platform.
But have you gotten metrics that showed the improvement from these symptoms?
So in the beta version, we did not measure the improvement in symptomatology. That's part of the next phase with the Mayo Clinic.
Thank
We have
you.
30 seconds left. Stephanie, can you ask the question and maybe she can answer in the chat for you?
Sure.
Well, I was just going to ask the same question Michelle did about outcomes. So I do want to commend you for tackling this. And you did mention payer strategy. That was one of my other questions. Can you comment on how you plan to work with payers?
Sure. So from an employer and payer perspective, we certainly see opportunity there to offer this platform to their employees and members. There's certainly a strong case to be made for menopause impacting women in the workplace and in their everyday lives. There's several peer-reviewed studies that demonstrate that impact.
Thank you. And we're going to have to stop you there. And we'll take a 1-minute break now for the judges to complete their scoring, and then we'll be on to the next pitch. Thank you so much, everybody.
Sure. Thank you.
Thanks, everybody. Okay, we're ready for our second pitch. Next up is Yael Heinen with Extrodes. Yael, you have 7 minutes. Go ahead.
Okay. Sorry. Where is it? Okay, sorry about that. Okay. Yeah, so hi, good afternoon from Tel Aviv. I'm Yael Heinen. I'm professor of electrical engineering and founder and CTO of Extrodes. It's a company we established 2 years ago to address a very major need, which I hope to convince you. So we're dealing with chronic sleep problems. and we all experience one time or the other some bad night sleep, and we know how awful it may be and how much it can impact our life. But chronic sleep problems is something much, much bigger. Chronic sleep problems is a real medical concern. And the big challenge is that majority of patients are underdiagnosed and undertreated. And the statistics is only 1 out of 15 patients will actually have access to sleep laboratory that would provide the exact assessment for the origin of their sleep problems. It also typically takes about 1.5 years to access a sleep laboratory. So there's a very, very major concern here. Now, the cost of chronic sleep problems is huge. They're associated with increased healthcare costs, with lost work productivity, and sometimes even with mental illness. It's a huge medical, but also huge economic challenge. 2 numbers just to provide you with some understanding of the magnitude of the problem. About 70 million Americans suffer from chronic sleep problems. It was estimated that in Australia, that the economic cost can reach up to 1.5% of the total GDP. So these are just huge numbers. Now, why is that? Why is it so difficult to characterize sleep and to achieve medical diagnosis? So sleep can be exactly monitored using PSG. PSG is a method that uses recording electrodes, uses electrophysiology to measure our brain activity when we sleep. What that means is that we have to go to a special sleep laboratory, sleep there with lots of electrodes connected pretty much all of our face. And this means that the technology is both expensive and very cumbersome. And the point is that using subjective reports from patients or bed partners, it's very difficult to reach a very clear understanding what is the origin of the sleep problem. It may be anywhere from narcolepsy, sleepwalking, bruxism, RBD, and many more. So it's very important and it's critically important to identify the origin. And here comes our technology. This is a technology that we developed over many years of research and implemented in the company. It's a smart skin technology that allows us to record brain activity, muscle activity, eye activity, and heart activity, and many more electrophysiological parameters using electrodes that are perfectly soft and completely integrated into the skin of the subject. It's an entirely alternative monitoring platform. And the most important thing is that it can be used anywhere, anytime, at very, very high convenience to the user and the overall users. There are hundreds of clinical and recreational uses. Of those different uses, which can go anywhere from epilepsy and rehabilitation and many, many more, we narrowed our focus onto sleep monitoring. It's a huge market of at least $6 billion and expanding. Within this activity, we started by focusing on sleep monitoring at home at low cost. We already validated the system under several conditions, including doing something that has never been achieved before, which is to record RBD at home. We're determining next best uses for the next stages. We're working on medical validation, our specific business model, FDA approval, and aiming to reach marketing and commercialization at 2023. So our timeline is very busy because we have to develop hardware, software, algorithms. So it's a technology, regulation, business, and production. We started in 2019. We have the patents, the biocompatibility test, the core business model. We already secured seed round with $4.7 million. We're working very, very hard on expanding our business validation and with strategic partners, moving from small scale production that we do today to mid-scale and large-scale production towards 2023, towards our commercialization. So about the validation here is extremely critical. In principle, what we're doing right now is we're performing measurements with our system in conjunction with a conventional system. This is done in sleep laboratories. We measure electrophysiology, we measure the EEG, we derive from the signals the hypnograms. Those hypnograms can then be compared one against the other, and this is the way that we can validate. And the most important thing is that we can validate that the information that we provide is completely and exactly the same information that physicians are using today in order to treat patients. The competitive landscape is very busy, and it may feel like it's extremely crowded field, but it's not, because most, if not all, competitors are basically in two extreme places. They're either at the place where they have a non-medical solution, or they have a medical solution or medical equivalent solution that cannot be used easily at home. So at the moment, X-Road is the only at-home self-use solution for medical grade sleep monitoring with multiple sensors. It's a long line, but that's a very, very important message. We have a wonderful team of people with wonderful expertise, going all the way from electrophysiology, data science, marketing, product development, managing R&D, and business.
Thank you, Yael. Your time is up, and it's time for me to turn this over to the Q&A with the judges. Thank you so much. Do we have any questions? Bill?
Yes, thank you. Could we see your slide for your exit strategies and partners? Do you have one for that?
Yeah. Well, not so much for the exit strategy. The partners that we're collaborating right now, we focus on the validation of the technology.
Yeah,
So,
and I'm sorry, I should have been more specific. I mean, channel partners for growth. Somebody's going to help you get to your growth goals.
yeah, so we don't show them yet because some of them are still in negotiation. We do have strategic partners that can help us penetrating directly into the sleep technology.
I guess maybe as a broader question without asking anything confidential, or do you think device companies or brand name companies, what type of companies do you think are your best partners
So
or
we don't-
accelerators?
So our core technology is really in a device, but we don't see ourselves as a device company or hardware company. We do see ourselves as a software company and as data company. The reason being is that once you have access to a lot of data and unique data, you can provide services that presently are very difficult to provide. And we do hope that it's not going to be just providing PSG against hypnogram against hypnogram, but you can do a lot more. What you can do beyond the present situation is provide an automated analysis. Hypnograms presently are analyzed manually. So we're working very hard on doing the automated analysis. There are a lot of features in the electrophysiological data that presently is studied mostly in research conditions, but not so much in a way that can enhance the effectiveness of neurologists and sleep specialists. So there's a lot more that can be done. So this is where we see ourselves.
Let me turn it over to John, and then Yvonne, and then Melanie.
Hi, this is John McKeever. A very interesting presentation. I guess to kind of follow up on what Bill asked, what is your plan for commercialization? Where are you going to generate revenue? So we understand the science, but.
So the way the revenue from the sleep will come from a task model. So a test as a service. We are aiming to interact directly with sleep centers, with general practitioners, with neurologists. We focus very, very carefully on the guidelines of the ASM, which defines very, very clearly what type of measures you need for each indication, for each medical indication. So this is the customers and are the people. The interaction is going to be directly with the physicians and the sleep centers.
Yvonne, go ahead, please.
Yeah, thank you for the very nice presentation. So I guess following up on the data set question, what kind of data set do you need for approval and commercialization? And then also, as you collect all of this data, which aspects are the most interesting, do you think, on the pharma or other kind of end user side to glean additional, beyond just the initial diagnosis, to glean additional data from?
Perfect. So the validation is really about or the data. The first type of data is, as you can see here, it's the hypnograms that we have to collect from multiple subjects, pending on indication, and validate the comparison, the exact comparison between the different measures of this particular graphs. And this is something that you have to do very systematically according to FDA guidelines per indication. You asked a very interesting question about other fields, for example, the pharma industry. So the pharma industry is extremely interested in these kind of technologies because it's a very major part, an important facilitator of clinical studies. So clinical studies, in many endpoints, sleep quality is a very, very important endpoint. And it's very difficult to quantify it, and very difficult to quantify it in large numbers at the home environment, which is much, much, much more representative than the sleep laboratories or hospitals. So therefore, we had already several partners, Teva, which is a very a big Israeli pharma company, Biogen, and we're in touch with a few others in this field.
Thank you. I think that leaves me.
Melanie, yes, please.
Thanks. Yael, great presentation. 2 questions. So first, while y'all are thinking about your pathway and what you need for approvals, are you considering pediatrics or just going for the adult population? I have to ask, I'm representing a pediatric hospital.
Yeah, so we already received a lot of feedback that actually probably one of the most, the easiest path and most straightforward would actually be with children, because this is where it's very, very appealing to send kids at home, or not to bring kids to the hospital. It also reduced the burden on developing a dummy-proof device, because you have the involvement of the parents. So it's a very, very interesting path for us. And the second question?
I'm glad to hear it's something y'all are considering. The second, and I don't know what I'm looking for here, but does Extrodes incorporate breath diagnostics as well?
So we through strategic partners, yes.
Okay, those were my questions. Thank you.
Sorry about that, everybody. We will take a 1-minute break now and allow our judges to complete their scoring, and then we'll get on with our third pitch. Thank you so much. Okay, thank you, judges. We are up to our third pitch now, so we welcome Lydia Henshaw with Resolve. Lydia, you have 7 minutes. Thank you.
Thank you. Can everyone see my screens?
It looks good.
Okay, great. Hi, everyone. I'm Dr. Lydia Henshaw, and I am the CEO and founder of Resolve, where we are on a mission to deliver happier minds for youth and young adults. We are targeting the $500 billion untapped digital health market. This is the mental health market for 58 million Americans in need of new mental health solutions today. And today we are starting with youth and young adults. So why youth? Youth are in distress because of the pandemic. Suicide is now the second leading cause of death for youth. 2 out of every 3 teens has experienced trauma. 4 out of every 5 teens is thinking about suicide, and these numbers are rising. The mental health solutions on the market today are not meeting this rising need. There are barriers such as access, affordability, transportation, and availability. We fill in these gaps with Resolve. We deliver a medicine-free, affordable approach to mental health support called peer support. And we deliver this evidence-based support through certified peer support specialists. A peer support specialist is someone who has survived a mental health challenge. They are close in age with the person that they are supporting. And as a survivor, they can connect on a level that clinicians are not able to today. A peer supporter's firsthand experience qualifies them to help. Peer supporters are trained and certified by state mental health departments. A peer supporter is a protective factor. Their role in mental health support is to be a listening ear and a connector to resources. They support in the many hours between a visit with a doctor or a therapist. Think about the hours that teens spend scrolling on social media. Think about the nights when a teen is laying in bed, some of them thinking about taking their own life. In these moments, our peer supporters are available on the other side of the phone. They are a quick text or a phone call away. They show up to support, to listen, to guide, and connect with resources. They improve the social and emotional health of a teen. Our specialists provide support through our HIPAA-compliant mobile app. Today, our current contracts allow us to engage over 700,000 lives. With your investment, we will be able to capitalize on this growth to reach more than 10 million lives by 2023. And we have an incredible team behind our mission. This can give you the confidence that we can deliver strong returns. I have led large teams building global software products across Procter & Gamble's consumer brands. I sold my last startup to a publicly traded company in a federally regulated space. Heather, my co-founder, has led large teams in front-end innovation at Procter & Gamble for more than 20 years. Dr. Honaker oversees our clinical administration. Most recently, he oversaw 1,700 physicians at Norton Healthcare. And Eric and Kenny's decades of healthcare expertise ensures that we can scale with excellence. So how does our business work? So we receive referrals from our business-to-business contracts. Referral comes from behavioral health providers or from the public school system. Our peers provide text and phone support to youth and young adults weekly. And peers also lead group support sessions for youth and young adults. Group session topics are proprietary to us, they're evidence-based, and they're developed with us in partnership with expert clinicians. So how do we make money? We have 3 business-to-business payers today. The first is Medicaid reimbursable service delivery. Peer support is reimbursable by Medicaid in over 43 states today. The second is through the public school system. Schools pay us to lead virtual group peer support sessions for grades K through 12. And the third is by white labeling our software for groups like the National Alliance on Mental Illness. This allows them to offer a free resource for their populations across the state. And while we grow our business-to-business channels, we are expanding into direct-to-consumer. There is a massive market for parents seeking affordable mental health solutions. Their children are receiving clinical support and medicine, but they're still struggling. We sell 6-week online peer support programs for specific challenge areas. For example, we sell a psychological readiness program for injured athletes. Think about the loss of identity that comes as a high school or college athlete when you're no longer able to play your sport. We have a waiting list for our injured athlete program. We also have a 6-week program on identity. These programs are developed with expert clinicians and delivered by our peer supporters. So how are we different from the competition? We are the only evidence-based, medicine-free, and peer supporter-led mental health solution on the market today. Maru Health and Sanbello deliver online counseling to consumers through mobile apps, but our multi-year contracts with businesses allow us to have a recurrence of referrals. We are the only offering in the market today with a white label platform. This allows us to establish long-term channel relationships in the industry, serving as infrastructure to support if we're not providing the direct peer support. And we deliver our program through trained survivors. This is a unique and unmatched benefit with strong evidence-based outcomes. And finally, we're different today because we're focusing on youth and young adults, which no other competitor is doing to this degree. Our annually recurring revenue is $130,000, and we've delivered over 5,000 peer support connections to date. We're raising a $1.75 million seed round, which will drive $27 million in annually recurring revenue by 2023. This funding will strengthen our technology by improving the user experience. It will also improve our marketing efforts, and this will expand our user base and our networks, making us a very attractive acquisition target in the next 3 years. I founded Resolve 2 years ago because I survived my own mental health experience, and I wanted millions of others to experience recovery as well. Will you join our mission by investing in us? Thank you.
Thank you, Lydia. Now it's time to turn it over to the judges. Judges, you have 8 minutes, and we'll start with Melanie. And Melanie, go ahead and start, please.
Hi, I am so sorry. I had my hand up from the last presentation and didn't put it down. But this is really incredible, and I'm excited to hear some of the other questions, and I'll probably pop back in if mine aren't answered.
Okay, wonderful. Next, we have Lisa.
Thank you, and thanks so much for your presentation. Can you maybe talk a little bit about some of the utilization trends that you've seen as well as outcomes?
Yes, utilization trends in terms of users connecting with peers. Yes, so today, as referrals are coming from the behavioral health providers in the schools, we see strong connection in terms of once we receive the referral, being able to connect with a peer, weekly sessions, almost 100% adherence. Once the peer supporter is able to connect directly with their client, what we found is strong success when a case manager or a therapist actually does a live handoff to the peer supporter, because you have the haloing effect of the trust that's coming from the therapist or the case manager, and then you also have the consent that's already built in from the parents. So we're seeing strong outcomes there. We've seen strong evidence around suicidal ideation and the role that the peer supporter plays. So one example, even last week, a peer supporter intervened when one of her clients reached out to her in the middle of the night with a suicidal attempt. She followed all of the crisis protocols and bringing in our peer supporter followed the crisis protocols, bringing in the therapist and the case manager. But even in the midst of those individuals trying to reach to that client, the only person that she would talk with through that moment was her peer supporter. So we see a lot of examples about that based on shared experiences and that life, sort of the life, survival that really brings strong bonds between the peer supporter and their clients.
Thank you. Next, we have Catherine up.
Hi, Lydia.
Hi.
I'm interested in what kind of training your peer supporters receive. You say they're certified. Could you describe a little bit about what that involves?
Absolutely. So the first criteria is they have to have a lived experience. So to be eligible to be a peer supporter, you effectively have to have been a consumer of the mental or behavioral health system. So that's the first sort of filtering point. The second is training through the Department of Behavioral Health. So it's a 60-hour certification training that trains on several things. One is just the history of mental health support in the nation. So what did it look like back in the 1900s? What did the trends look like? And how has the role of peer support emerged as a supplementary support? So they have context on historical precedents, but then There's a lot of training on things like motivational interviewing, obviously crisis management. Since the role of the peer is to use their story as a support in recovery, it's not to push their own recovery journey. It's to use their story and also basically to coach change readiness and to drive positive change. They're trained a lot around evidence-based ways to drive behavior change, such as motivational interviewing, positive support, or, reinforcement versus, focusing on the negatives. A lot of evidence-based approaches there. And then they sit for a certification training. So they have to pass the test. They have to get background checked. And then they have 20 hours of continuing education every year to maintain their certification.
Thank you for that. Elizabeth, you're on.
Yeah. Hi, this was sort of along the same veins of that. I mean, how do you manage privacy for, I suppose they're under 18, and then what sort of supervision is provided to give some comfort having your child engage with another child?
Yes. Well, so the first thing is they're not children. So our peer supporters are age 20 and above. So that's the first thing. Is sometimes there's a misconception of, because the name peer is in there, that it's a 13-year-old guiding a 13-year-old. But it's actually college age. We hire college age males and females and master's age level, even if they don't have to be enrolled in college, but that's the general age range. But in terms of just privacy, so we do have consent from parents in terms of understanding the role that peer support plays, but also the understanding of the escalation procedure. So if there are any crises, there are very, very strict crises protocols around who to inform, how to inform. If there's suicide, et cetera, they're notifying local authorities, identifying the location, those sorts of efforts. And if our referral comes from a behavioral health provider, our peers actually enter records into those EMR systems. So there's an audit trail of the type of support in line with their care plan for those providers. And then if we're working through the school system, we have feedback loops frequently back to the counselors in the schools that we're working with as well. And they receive weekly supervisory training and meetings as well. So a big part of peer support, we're working with survivors. And so we have a strong focus on our culture in terms of training they receive, mental health support that they receive as caregivers, and also peer-on-peer sessions. So, it's an incredibly diverse and passionate workforce that is unlike many workforces you come across today. So there's a strong peer-to-peer support network among the peer supporters themselves, but also our clinical supervision monitors and logs calls and talks with them about escalation procedures.
Thank you. Okay, Lisa, we have about a minute left if you want to chime in here.
Can you just clarify for us if your support is still done in conjunction with the physician or with the actual behavioral health provider?
For the most part, it is, but we also serve youth who may not have a diagnosis but are in distress. So in the public school system, we offer group support to public school students. So one of the districts we work with, 10% of the students are homeless. Many of them are in distress because of the pandemic. Many of them have been through trauma, but they're not under clinical care. So we come in and we provide group peer support, topical sessions on anxiety, social emotional wellness, a lot of identity. How do we communicate our identity to our families, and how do we have cultural appreciation? And what are microaggressions? Topics that are on the minds of youth today that act as a preventative support, even if they're not diagnosed with a condition that's a mental health challenge. So we really play on both sides. We play on the preventative side and on the recovery side as well.
Thank you, Lydia. Thank you, judges. And now we're going to take a 3-minute break right now. So I'm going to turn it back over to Aisha, and she can take it away from here, and I'll see you in a few minutes.
Aisha, you're on mute.
I am so sorry. Thank you. Great. job, presenters. I think we've heard some interesting and innovative pitches this morning. And I just wanted to take a minute and speak about the area of Ignite's focus, and particularly from this kind of a program. I think this group is well aware that women get less than 3% of the VC funding. And last year, actually, it declined to 2.3%. And so Ignite, through these events, showcases incredible entrepreneurs and hopes to move the needle on making funding more readily available for women innovators. We have grown tremendously in this space in the last 5 years, and that hasn't been without support. So I wanted to just say a big thank you to the TMC Innovation team. You all see Megan Howard, who has been with us for the last 3 days, and many more in advance getting ready for this event. Emily Reiser, Samantha Nava, Anna Vu was with us yesterday, and on January 20th, Tom Luby will be with us actually in the TMC's facilities. They have been our partners since the inception of Ignite and have helped us in countless ways to really improve our program and its ability to reach a broader population, to discover new and interesting female entrepreneurs, and to bring programs like this to life. So in the last 2 years, we've raised about $1.4 million for our entrepreneurs, and we are looking forward to raising even more in our January event. But the TMC has been a huge part of helping us to get here, and they've been really, truly wind beneath our wings. For those of us who live in Houston, Texas, we know the TMC and just how massive it is. And for those who don't, we have just a small video. We're going to do more, by the way, on January 20th to highlight all that is the TMC and the great partnership between the TMC and Ignite. So you'll hear more then. But for now, we're going to turn to a video that'll just be a touch of what is the TMC innovation.
Texas Medical Center is the largest medical center on planet Earth. In fact, you can take the second largest and the third largest, combine them, they still don't touch the Texas Medical Center. It's staggering. There are 110,000 employees, 170,000 operations a year. It's the largest collection of doctors on the planet. The scale here and the quality of excellence here is staggering. More patients come here, more clinical research happens on this campus. It's the highest concentration of awarded scientists in the world, where you can drive from research to clinical care faster than any other place on earth.
What we're trying to do here is take healthcare innovations and research and turn them into products that can help patients.
This is a partnership between the Texas Medical Center, the member institutions, and industry. We want the best of the best here, and they are coming, and they're coming in droves. J&J, the largest life science company in the world, here. Next was AT&T. Now we're working with Apple. We are creating this machinery of innovation that is unstoppable. The momentum is real. It's a place that will change the way in which discovery is done.
The innovation that is occurring here is tremendous. That you cannot replicate.
We have an unfair advantage. We're already together on one campus. This is the beginning of building a life sciences industry in Texas.
We're tremendously fortunate to have this partnership and to be able to have these resources focus on female entrepreneurs. So a big thank you to the TMC Innovation team, and more to come in our final event in January. So with that, I'll turn it back over to Gail to finish out this session.
Thank you, Aisha. Okay, well, this is the last three for this morning, and we'll start with Dor Vonk with Tired of Cancer. Dor, you have 7 minutes. Please start.
Thank you. So good morning all, and thank you Aisha and all the team for having us today and organizing such an amazing event. So today I'd like to talk to you about our company. I'm the founder of Tired of Cancer, which is a DTX company, and we focus on the #1 side effect of cancer and its treatments. And maybe we can just all think in our minds a couple of seconds that we think the biggest side effect of cancer and its treatments is. Is it nausea? Is it hair loss? Knowing this, and I hope my slide will go. Yes, there it is. Cancer-related fatigue is the #1 side effect of cancer and its treatments. And the impact is huge. The impact on personal lives is extremely big. So people feel stressed, depressed, they get isolated with all consequences. And it is not only with a very big impact for people's lives, but also on families and also on society. So think about medical treatment, medical adherence, and work. They are all affected by cancer-related fatigue. And if you look at the extent of the problem, it is 80% of all cancer patients during treatment suffer from cancer-related fatigue. And 35% of all cancer patients after treatment suffer from cancer-related fatigue, even for years and years. So if we look at the United States, we're talking about 7.3 million people today in the United States suffering from this devastating fatigue. And we see that there's no treatment, as usual, with a long-lasting effect. And we have made an estimation that the total cost of only on the work, if you only focus on work, is more than $5 billion. So with our backgrounds as a psycho-oncological team, our mission is to reduce cancer-related fatigue and improve the quality of lives of millions of people worldwide. And beside that, we find it very important to build a sustainable business model as well. So with our product, we improve patient-reported outcomes, we improve work productivity, save sick leave costs, we save healthcare costs, and with our product, we can enhance medication adherence. So this is what we made. It's the Entire app. And Entire provides an effective and user-friendly combination of non-pharmacological interventions, and they are fully aligned with the standards of care of the NCCN. It is a self-management program, and it really gives people insight into their own energy systems, and it helps them to break circle of energy leaks. So there's a lot of psychoeducation based on cognitive behavioral therapy, and there's a lot to learn about anxiety, stress, depression, and worry. And the backbone of the app is to stimulate people to get both physically as well as mentally active. Again, although that is very hard for people to do when they're so fatigued. And the difference from normal fatigue is that cancer-related fatigue won't go away after a good night's sleep. It just drains on and drains on. So the milestones we are today, the last couple of years, we've been focusing, the last 3 years actually, we've been focusing on Europe, especially because we are a Dutch company and we focused on the Netherlands, UK, and Germany. And until now, we are an effective, or we have proven to be an effective product. Independent university conducted an RCT study with published articles on our product. We are a safe company. We comply to GDPR and ISO certifications. We are a recognized company as well. So Independent Research Institute, they recently rated us among the top 5 oncology apps worldwide. We have an established user base of 34,000 users, and they are very engaged users. And very important, we are a revenue-making company. So these are the things in Europe that we've been working on the last couple of years. And unlike our competitors, we deliver on all 5 criteria. So let's look at the business model. Our business model is B2B2C, which means we have clients as health insurers, hospitals, healthcare systems, and disability insurers and self-insured employers. They are clients, they give entire app to their members, to their patients. And with that, they help their patients and their members feel better. And with better outcomes, it goes back to the customers, and the customers as well get data from our part, and they know more and they learn more about the needs of their patients and members. So, like I told you, we've been working in Europe the last years, and we want to make the big step to the United States. So the last year we have been working with our small USA team on building up a network. So we have established a first collaboration with the Dana-Farber Institute, and we hope to start a research this year. Furthermore, we are looking at partnerships because we think if we can combine our strength with another alike company, will we be even more impactful. And we start pilots with a first customer this year, and we want to expand our team. So looking at the coming years, we see more customers coming in. We want to have good research results, among others, the Dana-Farber. But at the end, and that's our end goal, we believe that we will be stronger in a complete portfolio of DTXs, because we believe that patients or doctors, they won't use several apps altogether. People won't have 10 apps on their phone. They want to have one shop to go to. So we believe we can be part of a very big platform and add our value there and be acquired by such a portfolio.
Thank you,
So
Dora.
Sorry?
I'm sorry, your time is up. And
okay, thank you.
Thank you very much. And we will now turn it over to the judges for Q&A. And we judges, we have 8 minutes. So Melanie, I see your hand up.
I do have a question this time. Could you tell us more about the results from your initial studies? Is Tired of Cancer, the entire app, is it reducing the fatigue, or is it helping patients to feel more prepared to combat cancer-related fatigue?
The results of the study, they show indeed a reduce of fatigue and increased quality of life. So, and it, of course, it also makes them stronger, right, to combat their cancer-related fatigue. Yes.
Okay, so it is actually reducing the amount of fatigue.
Absolutely, yes.
And that's across the 34,000 active users today.
Yeah, yeah. So beside the RCT study conducted by a European university, we constantly monitor our own data, of course, and we see the same results as seen in the RCT study. And we are also doing pilots with first customers, and that's always the same pattern. So it is really an effective tool.
And does it matter what type of cancer or the treatment protocols, if it's radiation versus chemotherapy versus something else?
Well, of course, the treatment has an effect on cancer fatigue. Yes. It doesn't matter which type of cancer you have. What we see is a big group of breast cancer patients using our app, hematology, and colon cancer. I think these 3 groups are our big group users, but it doesn't matter which type of cancer. It also, at the end, doesn't matter which treatment you got, because we see, especially the 35% of people after treatment, doctors don't see a real physical cause any longer. So that should be equal, right? So we really recommend people to start early with a program like ours, like Entire App, because it also prevents the fatigue really settling in and being more chronic. But at the end, too soon is not good either, right? If you just got diagnosed, then your whole world is turned upside down. So it's too early. So it's really important to find the sweet spot of giving the app to people. And we also focus on the long-term fatigue, because that is such a really devastating status people are in, and it really affects everybody around them, including work, etc.
Great, thank you.
Any more questions for Dor? Am I missing anybody? Just want to make sure. Don't see any more hands. Catherine,
Yeah.
go ahead.
Sorry to be so delayed. You say you're building a network in the US and you already have an agreement with Dana-Farber. Do you have any other, can you give us an idea of other cancer provider networks that you're talking to or in conversations with?
Yes, absolutely. We are in contact with the MD Anderson Hospital. We are especially in contact with large patient groups, advocacy groups, and with the American Cancer Society.
Thank you.
So I want to ask everybody who's interested in building up our team, please contact us.
Wonderful. I don't think we have any more questions. Going once, going twice. Okay, thank you very much, judges, and thank you, Dor. And we will now take a 1-minute break for the judges to wrap up their scoring. Go ahead. Thank you, judges. We are ready for our 5th pitch. Summer Barbaric with Hera Biotech. You're on. Go ahead, Summer. Summer, are you on mute?
Apologies. Thank you. I'm sorry. Imagine you woke up one morning in debilitating pain. The pain continued throughout the day, affecting your normal routine and disrupting your sleep. When it becomes too much, you go see your physician, only to have them dismiss your pain as normal. After what feels like an eternity of suffering, you find a doctor who thinks they have an answer, but there's a catch. The only way to know for sure is to undergo a surgical procedure that only has a 50% chance of confirming your diagnosis, and it might make your pain worse. Would you do it? This is the choice given to women with endometriosis, and with nearly 200 million women affected worldwide, we can no longer ignore this diagnostic deficiency. Women deserve better. My name is Summer Barbaric, and I'm the CEO and a co-founder of Hera Biotech. At Hera, we are dedicated to advancing the standard of care in women's health, and our first target for advancement is endometriosis diagnosis. Endometriosis, or endo for short, is a disease where tissue that normally lines the inside of the uterus grows outside of the uterus in the form of lesions. In addition to debilitating pain, it significantly increases your risk of mental health concerns such as anxiety and depression. It is the leading cause of hysterectomy for women in their 30s, and it is the #1 cause of female infertility. Currently, the only method for definitive diagnosis is a surgical procedure performed under general anesthesia that fails to confirm diagnosis about 50% of the time. We believe this is the main driver behind the 8 years and 10+ doctor visits that most women endure prior to receiving their diagnosis. Hera's solution, the Mitri DX, drastically moves the needle by taking diagnostic capability out of the operating room and placing it directly into the hands of physicians treating patients. With Hera on the market, a woman can come in for an office visit where her doctor will collect a tissue sample from inside the uterus. It's a very similar procedure to having an IUD placed. After collection, the sample is shipped to Hera's lab, where we will evaluate the expression level of our patent-protected endometriosis-specific biomarkers. Following analysis, both diagnosis and stage is shared with a physician, and together, physician and patient can begin clinically informed, stage-appropriate management of her endo. Hera's technology, licensed from the UT Health Science Center, will be the first of its kind, disrupting a $9 billion endometriosis market. The largest portion of this market is in OB-GYN practices and the remainder in fertility solutions. In terms of competition, our main challenge will be upending the standard of care. But with non-surgical sample collection, staging capability, and significantly improved accuracy, we feel confident in our ability to be successful. The other company that you see here is developing a blood-based test to screen for endo. What's important to note is that their test measures inflammatory markers in the blood, not specific to any one disease. Blood-based tests are most commonly used to give physicians direction for further investigation. But once a physician has direction, they'll need something definitive. And for that, Hera's test is up to the task. We intend to utilize a two-pronged commercialization approach, offering our product first as a laboratory-developed test, a strategy we lovingly refer to as the Everlywell model. This will allow for commercialization and insurance reimbursement prior to receiving FDA approval. We do intend to seek FDA approval and will use the clinical trials needed for our laboratory-developed tests to serve as pilots and inform strategy. Our projected incomes are driven off an average reimbursement price of $3,000 and a conservative adoption rate. The reimbursement price is consistent with similar sized gene panels currently being reimbursed, and the adoption rate is conservative given the number of new prescriptions written for therapeutics in the space. For example, you'll see in year 5 that we anticipate doing about 32,000 tests. Now that's only half the number of new prescriptions written for the leading endometriosis drug. We'll accomplish this with a combination of a small group of dedicated sales professionals and a contract with an established women's health sales force for distribution. We believe our exit potential to be a 5 to 10x revenue multiple. Now, I understand that's a wide range, but it will heavily depend on the type of acquisition partner, the status of our FDA approval, and whether we have any additional products in our pipeline. Spoiler alert, we have some ideas there. Something I'm particularly proud of is the team that's making this happen. Prior to founding Hera, I spent 7 years in life science venture capital, and I've been part of a $250 million exit. Our team includes the co-inventors of the technology who have unparalleled scientific and research expertise. And our board of directors includes industry experts in women's health diagnostics, women's health product commercialization, insurance reimbursement, and life science venture capital. I'm also quite proud of the progress we've made to date. Since founding Hera in February of 2020, we've secured a worldwide exclusive patent license agreement with UT Health. We have filed our national phase patent in 10 territories worldwide, and we've received about $100,000 worth of non-dilutive funding, including a grant from the Endometriosis Foundation of America. Most notably, we've completed a 20-patient pilot study in collaboration with Madigan Army Base and decorated endometriosis researcher, Dr. Rick Burney. I'm thrilled to report that to date, when compared to the gold standard, Hera's test has been 100% accurate in both diagnosing and staging endometriosis. We're currently raising a $1 million seed round via convertible note. It has a 2-year maturity, it pays 6% interest, offers a 25% discount into our Series A at a $15 million cap. This will allow us to complete a 60-patient proof of concept study, continue our national phase patent filing, and conduct a pre-submission meeting with the FDA where we will seek their buy-in to consider breakthrough designation. We have this round about 3/4 of the way committed, but we're still looking for a few investors to close this out. Additionally, we're able to oversubscribe the round should we find investors who are able to offer strategic value to our team. At Hera, we are proud to be a female-led women's health company offering real solutions to patients and practitioners, and we hope you'll join us on our mission.
Thank you, Summer. Nice
Thank
job.
you.
Okay, so we are ready for our 8 minutes of Q&A with our judges here. And Elizabeth, you're up first. Please start.
Hi, thank you for the presentation. That was great. When you were going through the numbers, it looked like you were only suggesting about 1% of the TAM. Why is that so low?
So it's so low because we understand that when we're ramping up as a laboratory developed test and then moving into FDA, we can only operate out of a single central laboratory. And this will actually be changing the way that physicians are working with their patients. And we know that that takes a kind of a learning curve. So we've kind of modeled very conservative numbers so that we're able to achieve those numbers. We hope to over deliver.
Thank you. Okay, next up is Yvonne and then Lisa and then Catherine. I'll remind you, but go ahead, Yvonne.
Thank you for the presentation. So one question on just the test itself. So can you expand a little bit more on what the analytes are and what the test is actually measuring? And then separately and related, I guess, though, is in the planned proof of concept study that you'll run later on, what's kind of the design and endpoints and main outcomes from that study going to be?
Absolutely. So the way that we're going to run our proof of concept study is the same way that we ran our 20 patient pilot study. So what we're comparing ourselves to is the pathology of lesions excised during a laparoscopic procedure. And what we're looking at specifically is we're looking at a group of genes called gap junctions, and specifically we're looking at the structural proteins connexins. So what we found is that when you separate the two main cell types of the endometrium into stromal and epithelial cells, this particular group of genes has almost perfectly negatively correlated expression. So on bulk analysis, it appears as though nothing is happening, but when you separate them and then we get to that single cell microfluidics, we see the change in the connexins. And what's impressive is that we've seen it in every one of the connexins that we've looked at to date. So you can kind of see these heat maps here, which is what is the output from our studies. And I've just grouped them so that they're easy to see, but essentially what we're looking at is this is a control patient. So these are stromal cells where the pattern would be going down, expression would be going down. And you can see that by the high red, there's a lot of expression happening. So over 18% of their cells are expressing high. And that's how we do our staging. It's a quantitative measures of the number of cells expressing high in those connexins. Does that answer your question?
Yeah, thank you.
Thank you. Okay, Lisa, go ahead, please.
Thank you, and thank you for your presentation. I actually have two questions. So my first question is if you could talk a little bit more about the partnership that you're having with insurance companies in order to get this covered prior to FDA approval.
Sure. So because we are a laboratory assay, there is a mechanism called a proprietary laboratory assay code. And so that is the reimbursement code that we would be seeking after we complete our proof of concept and then our validation. And we have a reimbursement consultant that we're working with. He's former head of reimbursement for IVDs at BD. So I feel pretty confident that he knows what he's talking about, but that's where we would be going for the reimbursement code. And then we would further seek to go under the ADLT program with CMS. We do qualify as an advanced diagnostic test. So we'd like to follow in Grail's footsteps there.
Okay, thanks for that. My second question really quick is maybe talk a little bit more about the adoption strategy with the physicians that you're planning in order to meet your financial projections.
Sure, absolutely. So we're having discussions, I should say, with an independently owned women's health laboratory who has a network of physicians, and we're working with them to kind of negotiate or work through distribution. We also have the opportunity to set up our own lab should we need to do so and go direct there. We've been working with some key opinion leaders, obviously Dr. Rick Burney at Madigan, but also the head of obstetrics and gynecology at UT Health in San Antonio, as well as the director for the Center for Menstrual Disorders in New York. So using those key opinion leaders, their networks, and obviously the sites that we'd be using for our clinical trials, that's how we anticipate moving into those clinician practices. Additionally, we're in discussions with some more established women's health companies who are looking to add products to their bag. And that is that, connection that I talked about, contracting with one of those larger organizations.
Thank you.
Okay, thank you. Catherine is up and then Stephanie behind Catherine. Thank you.
Yes, I'm interested in your lab resources. The doc obtains a sample of tissue from the patient's uterus and then sends it, or does what? Is it processed locally, or do you send it to some centralized lab? Describe that model for me.
Absolutely. So it is shipped to our lab, which is a central lab. We're currently using the lab at UT Health, but obviously we'll be doing that for our clinical trial. And then as we move into commercialization, we can, partner however that makes sense. So what we intend to drop off at the doctor's office is a kit. And actually I have a little mock-up there that you can see at the end. So there'll be a kit with the endometrial biopsy device in it. There will be shipping in it. The doc will collect the sample, and very similarly to how they do, other endometrial biopsies or even the pap smear collections, they'll drop it in a receptacle. It'll get shipped to our lab, and then we do all the processing on site.
Stephanie, go ahead, please.
I'm just wondering if this product would be available to primary care, or are you primarily just concentrating on the OBGYN market?
We're concentrating on OB-GYNs first because that's the primary point of contact for women who are struggling with menstrual complaints. And that's really the primary symptom of endometriosis, is a painful period. And so most women would go to their OB-GYN for that. We are absolutely wanting to partner with some health systems and make this available in hospitals for practitioners in the primary care space as well. A lot of women with endo, some of our research has turned up, they are 2.5 times more likely to go to the ER because of the pain. So it's definitely something that we've got out there in our mind. It's just that the primary point would be OB-GYN, so we want to work that route first.
Thank you. Any more questions for Summer today? Okay. Well, thank you, Summer. Thank you, judges. And we'll take a quick 1-minute break before we wrap up our session. Thank you. Okay, thank you, judges. And we move on to our 6th pitch, final pitch for our session today with Rachel Bartholomew with High Ivy. Rachel, you have 7 minutes. Please start.
Hello, everyone. My name is Rachel Bartholomew. I am from the Great White North up here in Canada, and I am the co-founder of High Ivy Health. When I was diagnosed with cervical cancer at 28 years old, I found out that I was going to need surgery and radiation that was directly going to impact my pelvic health for the rest of my life. And as I started my research, I found out that I wasn't alone. 1 in 3 women are dealing with non-curable pelvic health conditions, and these conditions directly impact a woman's day-to-day activities and quality of life. I also found out that we're dealing with similar symptoms such as pelvic pain, muscle tightness, scar tissue development from multiple hypertonic pelvic floor disorders, such as menopausal atrophy, postpartum tearing, endometriosis, cancer, and vulvodynia, just to name a few. The only options for symptom management include these painful, ineffective static dilators, which actually haven't been upgraded since 1938 and are causing our girls to continually re-enter the healthcare system with ongoing complications, costing our North American healthcare system over $90 billion. This is why we've created High Ivy Health. We create an all-in-one pelvic rehab system for women to help treat, monitor, and predict pelvic health-related illnesses and their symptoms. Our first products include a multi-therapy vaginal wand, providing hot and cold, lubrication, and dilation therapy, which are used in combination with biosensors, collecting the first quantifiable data set on the pelvic floor, which is tracked using our patient mobile app and our software portal that we've created for clinicians. This is how it works. The patient will visit their OBGYN or pelvic floor therapist with symptoms. The clinician will screen that patient and clear them for use of the device. They will process an order for the device and then set up that patient's treatment plan in our system. The patient will receive the device and unlock it with their prescription for use at home. The patient and their clinician can monitor and watch their progress, as well as meet anytime the patient goes off schedule, their pain levels are high, or they're not achieving the full prescription level. Patients will, without an active clinician, can actually use our high Ivy accredited clinics to get onboarded with a prescription on the device. Our patients, based on our own internal testing as well as our research, see a therapeutic impact that decreases vaginal dryness, pelvic pain, and vaginal stenosis while improving symptoms of incontinence. For OBGYNs, our goal is to reduce the time to clinical outcomes, reduce readmission rates, and reduce the frequent ER visits. For pelvic floor therapists, we improve access to their care through virtual monitoring and provide new revenue opportunities through device resale and virtual therapy sessions. We sell into 2 different multi-billion-dollar markets, targeting 50 million women in North America who can benefit from our product. We're the only remote monitoring device on the market, collecting multiple data sets, utilizing biosensors, and connecting patients to their doctors virtually that follows strict regulatory quality and clinical evidence. We sell the device at a one-time charge to the patient for $450, and we're currently working on potential insurance coverage. We also have recurring revenue streams with our consumable lubrication pod refills that are built specifically for our device, and a monthly subscription per therapist or doctor to our clinician SaaS portal for virtual patient monitoring. And we will achieve scale by first targeting the 5,400 pelvic floor therapists in North America, with a secondary clinical target of 47,000 OBGYNs once our devices went through further clinical research. To reach this market, we'll be selling our Canadian designed and manufactured therapy device through our community of high Ivy accredited therapist clinics we have developed through partnerships with the therapist educational systems and associations. These products will then be used to guide our R&D into our clinical use device, as well as a rectal device, and explore the use of our data to make a patient diagnosis. Our goal is to have an end-to-end integrative pelvic health solution that empowers doctor with data and allows patients to continue therapy outside of the doctor's office. We are 1.5 years into operation, and we already have a growing waiting list of over 400 women in active focus groups, as well as 50 LOIs signed with pelvic health clinics. We've raised over $740,000 non-dilutive funding. We filed our utility patent in the US, and we've secured multiple clinical studies for the use of our device in different patient groups. We also just closed our oversubscribed $1.2 million pre-seed round, and we have been listed as a global trendsetter in women's health out of 1,500 global femtech companies. Our immediate plan is to finish our benchtop testing and our first batch of manufacturing to get 100 devices ready for our clinical studies. Our goal for 2022 is to complete our first 2 studies so we can ramp up for our pre-sale and go to market for those target indications for use, while continuing our device R&D and furthering our research into other patient groups. We're in the process of achieving ISO 13485, applying for our ITA with Health Canada, and we've developed 2 strategies to apply to the FDA for Class 2, in which we're looking to validate with a pre-sub meeting that we're scheduling. We currently have 2 clinical studies secured, one with a group of endometriosis patients at McMaster University in Hamilton, Ontario, and one with a group of pelvic radiation cancer patients with the Grand River Cancer Center, where I was actually treated for cancer. Our goal is to study the change in chronic pelvic pain with the use of the high Ivy device, as well as a number of additional secondary targets. We have 6 additional target patient groups that we are actively seeking to run clinical trials on. To make this all happen, we've assembled a team of experienced, diverse, and majority female entrepreneurs, engineers, and scientists. We have over 15 postgraduate degrees, and we've run 6 startup companies in the past with exits. We're also led by 15 amazing medical advisors, along our 2 co-PI research leads from McMaster, who are helping us with our device research. We have 3 key asks from the fire pitch today. First, we're looking to connect with OBGYNs and pelvic floor therapists in the research space so we can run our additional studies. Second is intros to investors investing in large seed rounds. And third is industry players who are interested in pelvic floor R&D and look for potential partnerships. That being said, please join us and help us reduce the stigma around pelvic health and help us make women happier and healthier down there and everywhere. Thank you.
Thank you so much, Rachel. And so now we can turn it over to our judges for the Q&A. Let's see. Stephanie, go ahead, please.
Thank you for your presentation. I was curious, I really appreciated you putting your outcomes in the presentation, and how do they compare to the traditional methods from back in the 30s?
For sure, for sure. So I think the biggest thing with the traditional method is the adherence rate is so low. It's about 20% right now. And part of that we've noticed through our research is the ergonomics of the device, as well as the lack of accuracy in the way that the device actually works. I mean, really, it's just a candlestick with some Russian doll sizing on it. And so if we're able to actually track the data, see what the outcomes are, see how that scar tissue stenosis, atrophy is reducing, as well as how the body's responding to it, we're already seeing a lot more improvement from that basic static dilator.
Thank you. Other questions from our judges? I don't see any hands. Anybody? Okay, I think we'll call this a wrap. And
okay.
All right. So judges, while you finish up your scoring, I wanted to thank all of our companies in our session today who presented, and to all of these amazing judges who've volunteered so much of their time and expertise, time, treasure, and talent to help us with the judging. And this concludes our session, but please stay tuned for some final remarks from our founder and board chair of Ignite, Aisha McCracken. Thank you, everyone.
Gail, thank you. Fabulous job. To the presenters, everyone, great job and best of luck as this competition plays out. I have just a few comments. Well, let me also not forget the great judges. Thank you all for great interactions with all of these presenters. I think your comments, your feedback, questions really help them to continue to develop and evolve their company. So thank you all for your time and sharing your expertise today. 3 little announcements. One is, please complete your surveys and be sure to submit them. We did have somebody who completed and didn't submit, so want to make sure that you press the send button and that we've got your information included in the judging process. Secondly, we will announce winners on Monday. So keep an eye out on Whova. We'll go through Whova, LinkedIn, Constant Contact, sing it off of mountaintops, and let you all know the great companies that have made it past the semifinal round into finals this coming January. The Whova platform is going to be available through November 4th. So there is activity, there are questions, there are ways for that platform to continue to help everyone connect. We have just shy of 300 people involved in this ecosystem, which just sort of blew me away, to be honest. I was crossing my fingers as we watched the tally tick up over 200, but the ecosystem has been incredible. So it's a great platform for you to have a look at who the attendees are, look at the kind of questions that are being asked. People are connecting via one-on-one. So lots of great opportunity to interact on this platform. Don't forget about the People's Choice Award. That particular voting ends on, it ends tomorrow, end of day. And then last but not least, save the date, January 20th, Houston, Texas, for a big in-person party, and we hope to see you all there. Thank you so much to everyone for making this another fabulous session, and to all the startups. Best of luck to you. Thank you all.